Pertussis. Pertussis, also known as whooping cough, is an extremely contagious disease caused by the Bordetella pertussis bacterium. Bordetella pertussis is a small aerobic gram-negative rod. The bacteria produce toxins that analyze parts of respiratory cells, leading to inflammation in the respiratory tract. Transmission. The whooping cough bacteria are spread from person to person in airborne droplets or by direct contact with infected throat or nasal discharge. People contaminated their hands with respiratory secretions from an infected person and then touch their own mouth or nose. Coughing and sneezing are the most common modes of transmission.
Symptoms. There are 3 stages of symptoms. In stage 1, which can last 1 to 2 weeks, it is highly contagious, and the symptoms include a runny nose, a low-grade fever, a mild cough, and apnea. A pause in breathing can happen in infants. Stage 2 lasts 1 to 6 weeks, and the symptoms include rapid coughing and thick mucus that develops in the airways. Stage 3 lasts 2 to 3 weeks, and recovery is gradual, less coughing, but that can return, and you are more susceptible to other respiratory infections.
Pertussis diagnostic testing can be made through a nasopharyngeal swab or aspirate saline flush. Whenever possible, obtain a nasopharyngeal swab from all persons with suspected cases, or you can obtain an aspirate, which is a saline flush. Keep everything sterile. An NP, which is a nasopharyngeal swab, should be plated within 24 hours of collection. There's also PCR. PCR, or polymerase chain reaction, is the most rapid test. Ideally, the specimen should be collected within the first 3 weeks of the illness. There's also culture. A culture from the NP swab or aspirate has better specificity, but takes up to 7 days to get the results back. Pertussis should be cultured only on Regain low or Bordetella media. That's the only media that it will grow on. There's also serological testing, which is a useful method for diagnosing pertussis, especially in adults and later stages of the disease. These are confirming diagnostic results, especially during large outbreaks.
Treatments for pertussis. Pertussis is generally treated with antibiotics, and early treatment is very important. Treatment may make your infection less severe if it is started early before coughing fits begin. Treatment can also help prevent spreading the disease to close contacts or people who have spent a lot of time around an infected person. Treatment after 3 weeks of illness is unlikely to help because the bacteria are gone from your body, even though you usually will still have symptoms. This is because the bacteria have already done damage to your body. Antibiotics available to treat pertussis, such as erythromycin, Bactrim, and Septra. Prevention for pertussis. The best way to prevent pertussis among infants, children, teens, and adults is to get vaccinated. The recommended pertussis vaccine for infants and children is called DTaP. This is a combination vaccine that protects against 3 diseases: diphtheria, tetanus, and pertussis. There's a booster for preteens, teens, and adults that contains protection against tetanus, diphtheria, and pertussis as well. Boosters should be taken every 10 years. Like many respiratory illnesses, pertussis is spread by coughing, sneezing, while in close contact with others, who then breathe in the pertussis bacteria. Practicing good hygiene is always recommended to prevent the spread of respiratory illnesses. You can do this by covering your mouth and nose with a tissue when you cough or sneeze. Put your used tissue in the wastebasket. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand rub. If you or a member of your household has been diagnosed with pertussis, your doctor may recommend preventive antibiotics to other members of the household to prevent spread of disease. Additionally, other people outside the household who have been exposed to a person with pertussis may be given preventive antibiotics depending on whether or not they are considered at risk for disease.